Please invite to the stage with me Chris Curry is Clinical Director of Women's Health at OURA. Really great. You might as keeping Priyanka up here. I think it's kind of fun. It's on topic. Thanks. You've been here for a while, right? I've seen you kind of lurking around here.
I've been lurking.
And I said, you're absorbing everything. So we've been having a day on changing the game, and I think one of the issues we're interested in is every corner and quadrant of health and how we shake it up. You're very focused on women's health, which frankly, until I had read this, I had not really appreciated how kind of understudied, left behind, not part of the full package, the broad women's health spectrum is, which surprises me. Why is that?
Why are you surprised, or why does it happen?
Why have we allowed a healthcare system to evolve that is dismissing half the population?
Yeah. So to start with definitions, right? Women's health is the health of half the humans on the planet.
Right.
So it's shocking.
It is shocking.
We don't understand the foundational and fundamental biology of half the bodies in this room. Some of that is systemic. Some of that is rules and regulations that are not worth relitigating right now. So some of it is just part of the systemic research environment. I think the other part is there's an acknowledgement by researchers that female biology is complex. And in science, you want to control all the little aspects of your study. And so you don't want this background fluctuating biology making your results look a little bit messy. So that makes it easier or safer to just disregard that physiology. So that's what's happened for years is, it's too messy, it's too hard to interpret. Let's just use male physiology. So in one side we say the female is too complex, let's use male as the baseline. And then somehow we also allow the next sentence, which is, but then we can use the male physiology to be the standard for the female. So it's like a little nonsensical.
I mean, it is nonsensical. I'm just really totally surprised. So we all know the OURA ring, but hold up the ring. Everybody this is OURA of the OURA. And I see somebody in the front. I see people. There they go. They're OURA rings going up. And I guess my question to you have you solved that challenge with the OURA ring? Is it gender bending?
I mean, that's why I took a job there, right?
What's that?
That's why I took a job there, right?
Yeah.
The forward and public commitment that OURA has to not just right that historical wrong, that's a little bit too lamenting of the past, but to create an environment in which it is obvious that we should be studying sex-based differences in biology, sex-based differences in health and disease. That is the foundation of building the future, and so I think that's how we want to show up.
I mean, I want to go further than that divide. I would like to go to a much more individual level. I found very compelling what someone was sharing about each one of us kind of carries a whole different tapestry of medical realities in ourselves, and it's just kind of crappy that we don't finally get personalized medicine that's personalized with gender, race, socioeconomic dimensions and whatnot. Then we're failing, right? So that's kind of part of what excites me about this discussion. So I like you there. But you're also in the area that I'm really intrigued with, which is wearables. Now, I'm bad with wearables, but I'm going to get into it, And I've been on and off with Jawbone.
We can help you.
I mean, it's the charging things, that ends up being a problem. But I want to be there. But people have convinced me that our ability to track my iPhone tracking so much about just being on my body or near me or the steps I take is changing that. And I assume, as Priyanka, this or whatever, that part of this is going to feed into HealthX, or it can, right? So I'm interested in the interface, this new ecosystem of wearables, gadgets, collecting data, feeding it into health awareness and agency. And I want you to tell us where that's going.
Yeah. I'll come back to your first complaint, though, that you started it. But lots of people buy wearables and then they go in a drawer.
Yeah.
And the best wearable is the wearable you wear.
Yeah.
And I spent a lot of time at a prior company working on watch-based wearables and hadn't really appreciated the difference in form factor when it's a ring. In that people wear a device 23 and a half hours a day. And so the quality of data, the longitudinal nature of data, the way that it's just sort of in the background as a data collection as compared to like, oh, I gotta charge it every night, I think is part of that foundation that will allow us to be successful in women's health and in research. But I think to sort of the point about multi-layering of data before, you think about EHR data, super rich, lots of AI companies are appropriately looking at it to define signal and to learn. But EHR data is based on what I write in the chart, what you write in the chart. So there's some bias that is inherently what's in the chart. And then someone has to bounce off the healthcare system in the first place for that data to exist. So EHR is important, but it's not everything. And I think wearables are a really nice interstitial to that because they're there every day. So those punctate moments with your physician have this interstitial layer of what you are doing every single day as the N of one that you are. And then it reintegrates in an ideal setting through the lens of AI and interpretation, through the brain and the heart of a physician, back into a storytelling for one patient.
So you're using AI methodologies to create a consistency of data that can then be turned back into human interpretation.
Yeah, we have an interesting partnership that we announced probably hours ago at this point with Counsel, which is a telehealth AI-based platform where we're sort of testing the hypothesis that if our members consent and agree to share their data, including their EHR data, which they can now bring in, they can have a chat with AI, and we know that sort of back and forth and how far it gets you. But when it gets to the level where there should be a doctor in the loop, we offer to pull a doctor in the loop. So trying to build out that full circuit of, I'm curious about my body, I'm learning about my body, I can ask some questions of AI, AI gets me so far, but now this is like really a clinical question. And then a physician comes into the chat and is able to do that next layer, which may be prescribing or referring or just another depth of conversation.
How are you building in wearables?
Yeah, so I think it's this notion of having a really rich understanding of your entire 360 health. So it's your EHR records, it's your wearable data, it's your genomic data, it's your health plan data. And I think going back to your earlier point about, hey, why are people engaging in all of this in 2026? I think we have so much agency in our lives today. You know, we can pick any TV show we want to watch at any time. You can bank in really interesting ways. I think people want that same control in their healthcare experience as well. And so I think you are feeling a lot of desire for people to take control of their health, to think not just about what's wrong with them today, but also about how to stay healthier for longer, how to be there for children or grandchildren. And so there is this hunger that I think all of us have in living our best, healthiest life. And wearables give us that control. I think efforts like HealthX are meant to give people that control. But I think you're seeing this burgeoning in consumer-driven healthcare writ large that I think is really exciting. Having been in this space for 20 years now, you have services like Function and Prenuvo. And, you know, I think if you talk to the medical establishment, there's pros and cons to all of this, right? But I think what's undeniable is that desire for people to have control. And what we in healthcare in Washington need to think about is how to respond to that desire in a really meaningful way and not just say, hey, you can't do this, which I think historically has been some of the answer.
Yeah, I think the gatekeeping of physicians where we're like, you can only get objective data if you come see us.
Exactly.
Right.
It's like, that's so going away. It's all the patient's data, and we have the privilege of looking at it as a company or as a physician.
Right. I don't know what you're typing so much. I'm really impressed. So I love that you're doing. I don't know who you're doing it for, but no. I go back. You have an OURA ring. I do. Yeah. So I was thrilled with that. You put your finger with the first one I saw. So how's it going for you, and how do you use your data from that?
That's really loud. I mainly use it to track the different zones that I enter when I do cardio. I use every feature. I don't think that exactly just like one stands out, but I do really appreciate the women exclusive features, which is a reason why I bought it versus wearing like an Apple Watch or something, which I'm not really familiar with what the Apple Watch does offer. But, you know, when you brought up like the charging aspect, it's actually so funny because the battery lasts so long. I think I charge it for like an hour and it lasts days.
Guess I have to get one.
So I might call you out on that one.
Can guys get them?
Yes.
Yes.
Look,
That's the other half of the
all
planet.
questions are fair, right? So,
It's
you know.
the other half of the planet, right?
What's that? No, I have friends that, I thought their Oura rings, look, I'm a little bit behind on the whole wearable thing because I'm married. I've keep losing my wedding ring.
It's okay.
So, it is just, I'm going to get over it. I'm going to get an Oura ring and I'm going to learn.
I can tell you, my husband wears an Oura ring as his wedding ring, so it's 2 for 1.
That may be the answer that
Right?
I need. So, but I wanted to come to you and I wanted to thank you because I think it's great. I know there are other people out here that did this, and I want to thank both Chris Curry, Clinical Director of Women's Health at OURA. What a pleasure to meet you, and thank you for sharing with us what I think is really important too, which I had not realized was the gender disparities in the kind of health ecosystem, which ought to be part of this as well. And Priyanka Agarwal, co-founder and CEO of HealthX. Thank you both very much for joining us.